Changes are coming for an important vaccine for kids. Today, the Vaccine Committee for the CDC revised their recommendations for the vaccine that protects kids from measles, mumps, rubella, and chickenpox, and it's all in one shot. 12 News journalist Chase Golightly is here with us tonight to explain the change. And Chase, just to be clear, the revision doesn't mean that the vaccine's going away, right?
Mark, that's correct. This recommendation is to separate the immunization into two different shots for kids. One shot for MMR, then a separate one for chickenpox.
Vaccinating your children is a personal choice. We recently spoke with two Valley moms about this, one whose child has all his recommended shots.
It wasn't really a question for my husband and I.
And another whose child is unvaccinated.
It wasn't an easy decision.
Now the CDC Advisory Committee on Immunization Practices voted Thursday to change their guidelines on a key vaccine for kids, the combined measles, mumps, rubella, and varicella, otherwise known as chickenpox vaccine, a shot that the committee said shouldn't be given to your kids unless they're 4 years old. Instead, it recommends doctors separate the shot, with children getting the measles, mumps, and rubella vaccine at around 12 to 15 months and the chickenpox vaccine a year to 2 later.
It's unlikely that the kid's going to get exposed to chickenpox in that interim number of months.
A decision former Arizona Public Health Director Will Humble said really isn't a big deal.
If you're hearing or reading things on social media that make you believe that this was a terrible decision that's going to really inconvenience families or risk kids' lives, that's not true.
In fact, Humble says spacing out the shots is already common practice.
Many, if not most, pediatricians already separate the MMR vaccine from the chickenpox.
The committee, in its decision, says data shows that in rare cases, the MMRV vaccine caused very few toddlers to get fevers and measles-like rashes. In very rare cases, they suffered febrile seizures, which are seizures caused by fevers.
Nothing long-term and no permanent issues, but there were rare events like that. And the committee looked at that and said, we think these should separate.
After the decision, one of the committee advisors spoke about the change, saying this should also help put parents at ease who are debating getting their kids vaccinated.
As a pediatrician, I would rather have 2 shots with a decreased risk of febrile seizures. So that's how I looked at it. How do I address vaccine hesitancy?
Vaccine hesitancy is becoming more common in Arizona. A recent study shows a smaller percentage of people are vaccinated now compared to 5 years ago. The State Department of Public Health says there's currently an outbreak of measles with 46 reported cases. The majority of them coming from rural Colorado City and far northern Arizona, in a county that has one of the lowest percentages of vaccinated people.
Now, tomorrow is expected to be a bigger day for that advisory committee. They are expected to make revisions related to the hepatitis B and COVID-19 vaccines. We'll be sure to tell you their decision. For now, we're live in the studio. Chase Golightly, 12 News.
Chase, thanks.